All right, students. So can you able to hear me, see me, and see PPT? All these three clear? Can you hear me, students? Am I audible?
Yes, sir.
Yes, perfect. Okay.
Yes, sir.
Yes. Okay. So coming to the subject, it is advanced clinical chemistry, and the subject code is 20 MLB308, and we have only 2 units, as you know. In the first unit, you have toxic metals, second unit, cardiac markers, or say organ system markers. So in the unit 1, we discussed all these things, properties, heavy metals, like toxicity, their effects on environment, all these things have been seen. Then we discussed everything, their properties, effects, biological things, sources, anthropological causes. Yeah, then for every toxic metal, we will summarize it into 8 points like this. So then we have the following heavy metals. So we have discussed so far about aluminum, antimony, arsenic, and beryllium. Okay. So in today's lecture, I will continue with the cadmium and chromium. So let me do a quick revision of past lectures, and we can move on to the next one. So far we discussed about aluminum toxicity. Then we discussed about the second one, which is this antimony toxicity. Then we discussed about after antimony, we discussed arsenic toxicity. So arsenic is for killing rats. It's a very good poison. Then after arsenic, we went to the cadmium. Okay, so cadmium is used for, it has high temperature withstand, resistant to high temperatures. So it is also used in welding, and also it is a very good transistor, which have tremendous applications in radio waves. Okay, so yes, so all radio transmitters have this cadmium embedded transistors. Okay, so this is we seen. So this beryllium will cause berylliosis, which is a lung disorder. So beryllium will cause lung infection. Okay, so all these things are is about beryllium. So the next heavy metal we will discuss today is chromium. Okay, so today we will go with chromium. So when we are discussing about chromium, chromium is extensively used as a electrolyte, okay, electrodes in batteries. Okay, so batteries has a high amount of chromium. So sorry, I went with, I'm sorry, students, cadmium. Okay, so the next element is cadmium. So yes, so cadmium is used in batteries. Okay, and also cadmium is also used in welding rods because it has good electric conductor. So in the presence of this cadmium, the electricity can flow very fastly, so that it will enhance the heat induced welding. Okay, so cadmium, the sources of cadmium include agriculture. See, all heavy metals are used as a pesticides because they are heavy metals and they have some lethal consequences on life biology. Okay, in general, not only on humans, every animals have same enzymes, same metabolic pathways, everything same. At last, we are all breathing same oxygen, right? Animals or insects. So yes, these heavy metals are extensively used in pesticides in order to control the pest population in the crops and to get higher yields. So that is why whatever vegetables that we are purchasing, we need to wash the vegetables thrice or 4 times, okay, because they have these toxic elements. Even though they are washed, but they are subjected to preliminary wash. Still, it is our responsibility to clean in the running tap water. Better keep these vegetables in a bowl and add some salt and soak them for at least 5 minutes so that any metal traces will be washed off. Okay, so yes, cadmium is also used as a pesticide, and it is also there in cigarettes. So see, the maximum all heavy metals present in these cigarettes. So see, they are the dangerous substances. So keep this in mind. Okay, and smelting and anthropological activities like mining can also cause this cadmium toxicity. So that's it. So from mining, from electroplating, from electricity, pigments, batteries, weathering rocks, waters, from industrial uses. So these are the primary sources of getting cadmium. So yeah, so this is the adverse effect of cadmium. Cadmium has a high influence on musculoskeletal system and renal system. So this bones will get deformed in the presence of this cadmium. Okay, so it results in a curvature of bones, then osteoporosis. So bone will get affected by this cadmium toxicity. Okay, and also there will be stones formation in the kidneys. Okay, so yes, so this cadmium will cause effects on bones and the kidneys particularly, and in case of lethal complications, the organs will fail and patient will die. Okay, so one more thing I thought of this cadmium also present in cement. Okay, battery and cement, our regular cement also have this cadmium, and chromium also present in cement. Okay, so cadmium and chromium is present in cement. So the workers who are working with this cement, they are likely to prone to this chromium or cadmium toxicities. Okay, so yeah. So introduction to cadmium. So cadmium is every metal is present in the earth. Okay, and small particles may present in the air, and it is extensively used in the combination with zinc, lead, copper in the batteries. Okay, since it is a very good electrolyte, it can conduct electricity. So yeah, so yeah, cadmium is extensively toxic, and recently in McDonald's we identified some cadmium trace metals in McDonald's glasses. Okay, they're using some glass. I don't know. They say shirt glasses. So these glasses have cadmium. So yeah, so this incident happened recently. So yes, tobacco has this cadmium, and also cadmium is present on vegetables, since vegetables pesticides are used on vegetables, so there is this cadmium presence on vegetables also. So what is the so far we've seen the sources and general introduction, then pathophysiological effects of cadmium. So the physiology of cadmium include cadmium will enter into the body either by water, air, or soil. Okay, it can enter via these three by routes of two routes, either by seafood or by food and animal products. Okay, seafood. That means cadmium has been dissolved in the water, and the water animals, we took those water animals as a diet, and that is how this entered into the body. Okay, via this food chain contamination. So ultimately, after entering into the body, now this cadmium will cause two important system dysfunctions. One is a renal system dysfunction, and other one is a skeletal system dysfunction. Okay, the musculoskeletal system dysfunction. So it results in osteoporosis to the bones, whereas tubular dysfunction in the kidneys. Usually, this cadmium will deposit within the kidney, and it will alter the acid base. There is something called reserve, alkaline reserve in the kidney. So the overall pH of kidney will be in base, and maintaining this alkaline reserve is very essential for this filtration purposes. Okay, the electrolytes and trace elements will filter in the kidney by the process of osmosis. In order to have this osmosis, we must have this one renal proper kidney function. Okay, so this is the effects of cadmium on bones and kidneys. Okay, then in the intestine, and it can also cause gastrointestinal irritations and lung disorders. Okay, so this is all about the cadmium. And the toxicity, it will cause lung and kidney disorders. And secondary effects of skeletal system results in skeletal system deformities, same story. Okay, the symptoms. Then cancers. Yeah, in complications, this cadmium can also induce cancers. Okay, so there is this carcinogenic property of cadmium also has been reported. So symptoms of cadmium toxicity: food poisoning, bronchitis, inflammation to lungs, intestinal pneumonitis. By inhaling these cadmium fumes, we will get this intestinal abnormalities, pulmonary edema, and some other medical conditions include osteoporosis, osteomalacia, hyperuremia, hypophosphatemia, then itai disease. I don't know what is this itai disease, and renal failure can occur. Okay, these are the few symptoms of this cadmium toxicity. Then diagnosis of cadmium. So cadmium can be diagnosed by taking urine sample. Okay, so with urine sample we can detect this cadmium traces of cadmium, or we have another indirect evaluations like a detection of urinary beta 2 microglobulins. Okay, elevated this microglobulin levels beyond 300 grams indicates in proportion with creatinine indicates a possible cadmium toxicity, and urinary retinol binding protein assay and metallothionein test. This is a biochemistry test can be done for evaluation of cadmium toxicity and the critical levels of cadmium. So if the cadmium level is greater than 10 micrograms per liter, that indicates critical levels. Okay, so this is all about the cadmium toxicity. So treatment of cadmium. So elements like calcium and selenium are shown to have protective against cadmium. Okay, students, I want to tell one important thing here. See, any heavy metals can be neutralized, and that neutralizing step can be achieved with the help of calcium. Okay, so calcium has a very good neutralizing properties. So any heavy metal combining with calcium will make it into a non-toxic product. Okay, and this process is called chelation. So chelation can be achieved with the help of calcium. Okay, and also we can rely on certain antioxidants like vitamin E, glutathione, methionine, glycine, cysteine has shown good effects. Okay, treatment remedies for treating these heavy metal poisons, including our cadmium. So this is all about cadmium and prevention. So smoking is the primary cause of getting exposed to this cadmium toxicity. So giving public awareness on little consequences smoking can able to decrease the exposure of cadmium toxicity in the population. And I said, right, so chelation therapy. So chelation therapy means here we are using calcium in order to neutralize the toxicity of cadmium. That is called chelation therapy. Yeah, so whatever prevention, same story. The people who are working in mines, they should have proper protective equipment, gears, and they should not smoke this cadmium containing dust. Then they should not have this smoking habits. So all these things will minimize. And also, since this cadmium is entered into biology human system via water, so purification water and periodic tracing, screening of water of presence of any trace elements or heavy metals will reduce the risk of getting this heavy metal toxicities. Okay, heavy metal exposures. So this is all about the cadmium. So in a nutshell, so yeah, this is a thought of telling you. So smoking is injurious to health, and that is really serious. Not only nicotine or the substances present in tobacco are dangerous, but also the other mixtures we are using to get the this smoke has many heavy metals. So smoking is always injurious. So stop smoking. So a quick overview of cadmium. So cadmium is usually used in batteries. Okay, so cadmium toxicity will cause bone disorders, especially osteoporosis, and also kidney stones can occur due to cadmium toxicity. Okay, these are the two important symptoms of cadmium, and that's it. This is all about cadmium. So then next heavy metal we have is chromium. Okay, so what is this chromium? So let us see this chromium toxicity. So yes, chromium. So this chromium, so Google Chrome, I'm not discussing about Google Chrome chromium. So I'm discussing about the heavy metal chromium. So this chromium has this metallish texture. Okay, so that is why chromium is also used as an alloy in many metals to get that shininess. Okay, so and that is how we are exposed to this chromium. So chromium exposure can happen by metallurgic activities. Okay, because chromium is a very good alloy to amangle or to mix with. Okay, so and also chromium is extensively used in cement. Okay, cement has that some metallic texture, so that the metallic texture of cement is provided by this chromium. Okay, So in refractory and iron casting, we are using chromium, such as in iron and steel, cement, glass, ceramic, and metallic. Wherever we have that shiny ness, that silvery shininess, there is the presence of chromium. Okay. And in metallurgy, we are using metallurgy means here we will try to try to fuse any two metals to get its more rigidities. Okay, we will try to change the properties of metals by fusing more than one metal. Okay, so yes, stainless steel, alloy metals, and also in chemical industry, we are using this chromium metal for leather tanning, electroplating, preservative. Okay, chromium is also used as a preservative and pigment. And they haven't said one point here. This chromium is also used in fireworks, explosive fireworks. Okay, so in fireworks also we are using this chromium. So the people who are working in these fields are likely prone to get this chromium toxicity. Okay, the people who are working in this steel industries, in cement factories, in iron factories, or even in this preservatives and this uh, things. Okay, they are likelihood to get this chromium toxicity. And yeah, how we will get exposed to chromium? So the main source of exposure is by air. Okay, many these industries, upon enriching or upon utilizing these heavy metals, they are dumping their waste in the form of into the air by either by dust or by mixtures or by gases. Okay, and this is one of the deadliest way of killing people. I don't know why the government is encouraging these industries to be established near cities or within the populated areas. These industries have very lethal consequences on civilians because of their release of these toxic elements into the air. Okay, yeah. So industries is one dangerous source of getting these heavy metal poisons. They are not only polluting air, but they are also polluting land, soil, even ecosystem. So the best approach of establishing any industry is in deep far away from societies. Okay, but we are always greedy, right? For our greediness, we want these industries close to the people, so there will be easy movement or transport, and that is one reason why we have these issues. No matter how many measures we are taking, still this is a global concern, and there is no limit to the sky. We cannot blame that we are doing best practices, but the fellow country, which might be a poverty country, and they may don't have these safety procedures because it is costly, and that might causing the global issues. Yeah. So yes, industries is one major thing. So coming to the chromium. So chromium is one of the trace elements which is used. Okay. So now I want to shift this lecture to another thing. So for past 5 to 6 heavy metals, we are being so negative. We are only discussing about their harmful effects, right? So we are keeping these heavy metals as villains and enemies in our story. But today, this chromium is the first thing which has some health benefits. Okay, so let us be some positive about chromium. So we do require chromium for in a trace amounts because chromium has very good health benefits. Okay, now this chromium is found in 4 forms. Okay, chromium 0, chromium O, chromium 3, chromium 6, and chromium and other forms. Okay, so one of this form of chromium is has many health benefits. Okay, so I will show you. So they are saying hexavalent chromium, trivalent chromium. I will show you the good form of chromium. So 1 second. So chromium is present in all steel products, and chromium also present chromium 3. Okay, chromium 3, we require chromium 3 because it is a very good cofactor for enhancing the enzymal activity. So for proper functioning of enzymes, we need this chromium, and the chromium is present in this. In Telugu, these are called mirial. I don't know what you will say in Hindi. So I don't know in English also. So they have rich source of chromium, and broccoli has chromium, chicken, meat has chromium, corn, and even cereals. Okay, these clam fishes have this chromium. So chromium 3 is very good cofactor for enzymal activity. So chromium is found in these sources. Okay, So chromium helps in reducing cholesterol, maintaining diet. It regulates glycemia. Insulin will work effectively in the presence of chromium. Okay, so the glucose, the diabetic patients must need this chromium 3 supplementation for good, for better insulin activities. Okay, so keep in mind chromium has health benefits. When I say chromium has health benefits, eh, only one form of chromium, and that is chromium 3. Okay, chromium 3 is very good for diet. Okay, so as I stated, chromium 3 is a cofactor of insulin, helps regulating glycemia. Chromium improves the tissue sensitivity towards the insulin, and this chromium is useful to treat type 2 diabetic mellitus patients. Okay, so first time we are seeing a element that has some good health benefits. So when I say health benefits, it is one form of chromium. Chromium 3 has very good health benefits, whereas chromium 4, again a carcinogen, and again it shows toxicity. Okay, yeah. So chromium 3 is essential nutrient for humans, and shortages, chromium 3 shortages will cause some skin rashes and many glycemic problems. Okay, and coming to the chromium 4, as usual, all toxic effects. Back to our business of scolding these heavy metals. Okay, so chromium 4 has all negative impacts, like it will develop skin rashes, obstruct stomachs, ulcers, respiratory problems, weakened immune system, kidney and liver diseases, alterations of genetic material, lung cancers, and death can also occur by this chromium. Then, yeah, so anything excess will be dangerous, right? So even excessive amount of chromium 3 will cause its own consequences on biology. So there are many tablets available in the market that has this chromium 3 supplementation. Okay, I hope you know this metformin tablets, which are used for diabetic control of diabetic patients. So that metformin tablet has chromium. You just go through the ingredients in metformin. You will identify chromium 3 as a ingredient in metformin tablet. So yes, chromium 3 has many good benefits, as I stated. And also chromium 3 is available in many vitamins. Okay, so this chromium 3 is available in all types of vitamins, like vitamin A, B, B1, B2, B3, 6, 7, 8, 9, 10. So all vitamins have this chromium 3. Okay, and probiotics has chromium 3. And okay, so the daily adequate intake will be around 25 micrograms. So at least we should get 25 micrograms of chromium in our regular diet. Okay, and this chromium is also very important for newborn infants. Okay, it enhances the infant's digestive system to digest the mother's milk. So these are the health benefits of chromium. So all these are the medical uses of chromium. Since chromium 3 is good at maintaining healthy enzymes, this chromium 3 is used in many medications that will, I forgot this term, they have this positive impact on enzymal activity. I forgot that particular term. Anyway, so chromium 3 is used for HIV treatments, for treating depression, Turner syndrome, polycystic ovarian syndrome. So PCOS, very serious problem among teen women who are in menses. So they are getting this ovarian problems. So they are getting this air bubbles formation in the ovaries because of excessive insulin activities, and most likely that they will become sterile. They are unable to bear their pregnancy. Okay, so this PCO is becoming global concern, especially it is affecting young teens. So even PCOS can be regulated by giving chromium 3 supplementations. And also chromium 3 is good at decreasing cholesterol, so no more heart attacks. And also it is a very good beta blocker. Beta blockers are the main reason for getting ischemic heart attacks. That is a heart attack which is mediated by electric conduction activity of heart. So that SA node and AV node will function effectively in the presence of chromium 3. And chromium 3 also used for obesity, metabolic syndromes, heart attacks, schizophrenia, neurological problem. Okay, it's a depression with this is called bipolar disease. So they will have this depression, and all these uh, diseases can be treated with chromium 3. Okay, so yeah, first time we have seen a good candidate, a good heavy metal. Yeah, signs and symptoms of chromium toxicity, as we stated: gastrointestinal irritations, nausea, vomiting, diarrhea, fever, vertigo, cramps, intravascular hemolysis, circulatory collapse, and liver damage can occur. Okay, same stories. We elaborated in next two slides. I mean, the further complications: rhinitis, sinusitis, keratitis, gingivitis, etc. Okay, bronchitis. These are the inflammations of the corresponding organs. Okay. So yeah, how to diagnose chromium toxicity? So chromium toxicity can be directly diagnosed or indirectly we can detect. Indirectly we can detect by blood urea nitrogen test, creatinine levels. Especially we will go with detection of beta 2 microglobulin levels and chromium levels directly by spectrophotometric and flame photometric analysis. Okay, so this is all about the chromium. And coming to the treatment, there is no proven treatment. There is no antidote has been identified so far in order to treat this chromium affected individuals. So we haven't got any chelating product for neutralizing the toxicity of chromium. So better we need to be cautious on getting this chromium. If any heavy metal has treatment means that is fine. We can able to manage the patient. If something does not have treatment, that will be really dangerous. There is a high chance of death of patient. Okay, so chromium is one of them. Yeah, so we will try to usual things in any toxic things, toxic exposed patients. We will go with bronchial lavage, and we will remove all the gastric juices if it is via GIT. Then also we will try to hemodilate the blood. Okay, we will keep this blood to a dialyzer, and we will remove all the. We will try to reset the blood again. We will reboot the system. Okay, biologically speaking. So that is how we can do for any heavy metal toxicity. So prevention is better than cure. So we have certain preventive measures to not be exposed to chromium toxicity. So that is good idea. So this is all about today's session, students. So in today's session, we discussed about two elements. So one is chromium, and other one is cadmium. Okay, a quick revision. So this cadmium is used in batteries. Okay, so exposure to cadmium will cause osteoporosis and renal problems, and it is also carcinogen. Okay, and cadmium is extensively present in tobacco products like smoking. Okay, then we discussed about chromium. Chromium is present in cement, and it will get affected by air. Okay, and chromium has certain health benefits, and that form of chromium is called chromium 3. So chromium 3 is very essential for enzyme activities, especially lowering the cholesterol, enhancing the insulin activity, and for controlling diabetes, we are using this chromium 3. And chromium 3 is also found with a mixture of other vitamins supplements. And chromium 3 is also present in probiotics. So all these things are the uses of chromium 3. Okay. So this is all about today's class. If you have any doubts, you can ask me regarding cadmium and chromium. So I would like to have a small session on this topic. Let me add one empty slide here. 1 second. Let me share my computer screen. Okay. Yeah. Can students, can you tell me what is the difference between signs and symptoms? Do you know this one? Because many people are unaware of the difference between these two. Can you tell me what are signs and what are symptoms? Can you tell me the difference between signs and symptoms? Anyone? You can also chart. You can give your answer in chart box. What is sign and what is symptom? How you will define sign of and what is symptom? Can you tell me, students? Signs and symptoms. What are signs and what are symptoms? Any idea? You can text in chat box. What are signs and what are symptoms? Okay, let me say. So we got a patient with suspected jaundice. Okay, so now if we got a patient with jaundice, and what we will do, we got a patient to our hospital, then we will try to look for any clues of having jaundice in the patient without asking any questions. So we will go with his eye examination, whether we will see eyes are discolored into yellow or not, skin examination under the tongue, mucous membrane checking, and swelling of abdomen. So the things that we can measure without asking the patient, they are called signs. Okay, we are trying to identify the signs of any jaundice signs. Okay, like a yellowish discoloration of skin or eyes or mucous membranes. They can be stated as a signs. That means signs can be visualized without asking questions. Signs can be visualized without asking any questions from patient. Without patient feedback, we can able to assess signs. Okay, without patient feedback. Whereas we don't know some problems to the patient, like whether he has stomach pain or not. Until he is responding, we cannot guess whether the patient has stomach pain or not. And they can be stated as symptoms. We can understand symptoms only after patient's input. Okay, only after patient communication, we will know the symptoms. So this is the major difference between signs and symptoms. So first we will go with signs and we will ask appropriate questions relevant the symptoms present in the patient or not. If the symptoms match with our signs, then definitely there is a correlation with these two and we can draw a conclusion about the possible disease to the patient. Okay, so this is the difference between sign and symptoms. Signs are something which we will know without patient's help, whereas symptoms we will know only after patient giving input to us. Okay, yeah. So by this, I'm ending today's class, students. Thank you very much. Thank you very much, students. You can leave.